The journey of caring for a loved one who is living with dementia can be quite challenging. The aim of this podcast is to make caregiving less daunting and more fulfilling. On this platform, we share knowledge, understanding, and experiences. We enlighten, give hope, and encourage, and in the process, create positive awareness about different aspects of dementia. Welcome to my podcast, Dementia Caregivers Corner. My name is Julia Ratladi. Dementia Care, how deep is your love?
Our guest in today's episode is an accomplished internal medicine specialist with over 14 years of dedicated clinical experience across various hospitals and clinics in the USA. His expertise extends to the comprehensive management of diverse medical conditions, encompassing both acute and chronic, strong emphasis on medicine for the elderly. He has taken care of many geriatric patients with different stages of dementia and has consulted their families regarding their caregiving strategies. Our guest boasts a prolific academic portfolio, having authored 3 books and more than 26 research papers featured in renowned medical journals. His contributions have garnered substantial recognition within the medical community, evidenced by over 370 citations. That's quite a lot from fellow physicians and scientists. Our guest presents the combination of his extensive clinical background and unwavering commitment as concise but comprehensive books. His books provide expert medical guidance, readily accessible and comprehensible to the general public. Let us welcome in today's episode our none other than Dr. Sam Torogi. Dr. Sam, welcome to Dementia Caregivers Corner podcast.
Thank you, Julia. It's great to be with you, and thank you so much. It's my honor to appear on your podcast. You have a great podcast, and I know you yourself is on a journey of bringing and raising awareness for dementia throughout the world. And I know you have your personal experiences as well. And I'm glad that I can participate in this noble cause of raising awareness towards dementia and how to deal with it and to help caregivers. And I'm happy to be here with you.
Good.
And help to all your listeners as well.
Yes. Let's get into it then. You know, Dr. Torogi, when I came back,
Sam, you know?
Yeah? Sorry?
Just call me Sam. Sam.
Oh, okay. Thank you. Okay. Sam, when I came into the UK, I thought I didn't met anyone living with dementia. And so when I came into the UK and started volunteering my time and interacted with people living with dementia, I immediately, picked up the behavioral and psychological symptoms of dementia that were similar to my grandma's back home. And so I was like, oh, okay. Is there a possibility that my grandma might have had dementia but was not diagnosed? Mm-hmm. So if you were to meet with someone like that who doesn't have an idea of what dementia is, or somebody with a limited information on dementia, how would you describe that in simple terms? How would you describe dementia to those people?
So it's a very good question, and it's going to be helpful to so many people. But at the same time, there's no simple answer to this question as well. It can be challenging and it can be difficult. In terms that a lot of times, especially when people get old, they can experience, normal aging symptoms, which is, becoming a little forgetful and having a little bit of change in personality or change in how they manage their daily routines and stuff like that, or their communication. So a little bit of these things might happen in normal aging. However, when we see that things are getting really out of ordinary in terms of intensity, meaning that we see, for example, like deep personality changes or forgetting things that are, again, this is subjective. Okay.
Yes.
So every person might experience it differently. So I cannot really put a line for that.
Yes.
And that is actually the challenge.
Yes.
However, we look at the intensity of things first. Like we see that people forget like routine things, which is getting worse and worse throughout the time. It starts with forgetting like this, the short-term memory gets affected first. So forgetting like your daily things that you're supposed to do. And then when it gets more and more intense, it progresses to a more longer term memory stuff. Like, for example, you forget the route to your home, you might start wandering around. You might forget like what was your routine. You might forget that you've been retired, for example, if you see your loved one is saying, oh, I'm going to go to work today and things like that. And this keeps repeating. Or we see deeper personality changes towards us, like communication problems. The challenge is that in the beginning, people try to cope with it like any other changes that happen in life. They might think, oh, it's a regular thing, it's a normal thing, it's temporary, and it might be. But if we see that it's constant and it's getting worse and progressing, it's time to get assessments. And that assessments cannot really be done on our own. Like, a caregiver or a family member cannot make that diagnosis or be sure of that diagnosis or make that assessment on their own. So it's very important to get help first step from a primary care physician, from the family physician, so they can do a more comprehensive assessment of how things are going in terms of making that diagnosis or seeing that, okay, this might be something temporary or some effect of like a different condition versus it's a dementia, it's an early phase dementia, and it might be progressing towards more severe phases of dementia that can affect so many things.
Yeah.
So there's really not I would say, very exact line. It's a very, I would say, gray area, especially in initial stages of dementia.
Yes.
That we might see those changes, but we're not sure. We might start dealing with it. And actually, it reminds me of one of my readers emailed me, and she said that at first I was, trying to cope with it, and oftentimes it might break into a fight or something because they feel like their loved one, their spouse, is not understanding them or is not being supportive. And I think this is one of the biggest challenges because we're not thinking about that. We're not thinking about dementia. We don't know if it's dementia, and more importantly, we don't want to believe it's dementia. So we chalk it up to regular behavioral thing or changes or thinking, oh, do they not love me anymore? Things like that. And that might start some conflicts in personal life as well, which oftentimes, again, and we'll talk about it later as well, which oftentimes can lead into some guilt later on, thinking that, oh my God, they were sick, but I was fighting with them. I thought they don't love me anymore and things like that. So I can go on about like the diagnosis part as well, but I don't want to cut your questions and stuff like that. And because especially with my background in medicine, and I can talk a little more about the diagnosis part and stuff like that as well.
You have said quite a lot there. And obviously, as we go along with our conversation, we are going to get into some of these things that you mentioned there. But one thing that you mentioned, I think you talked about early stages of dementia. Do we have like different stages in dementia? And how do you differentiate them, and how do they affect maybe the person living with dementia or their caregivers? Describe those stages of dementia, if you can.
Yes, yeah, of course. We define different stages for dementia. Like specifically, we can say like there's 7 stages, from very mild to very severe, actually. And the main differentiating factor is the intensity of the symptoms, which is, at the end of the day, it's very difficult, and I would say quite impossible to make all those distinctions with exact lines, as I said, because it's an evolvement of symptoms from very mild stage to the very severe stages. So one might go to 10 different physicians, and they might have different assessment of what stage you're in. Of course, they're going to be in the same area. For example, one might say, oh, you're in stage 2 or 3. The other might say you're in stage like 4, I think. It's like it's going to be back and forth because all these symptoms and everything, there's a big component of subjective assessment to that. So there are overlaps. There are like gray zones in between. However, to answer your question and not to just ramble about everything, there is 7 stages, and I can just quickly say a little about each stage. Like for example, stage 1, we don't have much cognitive impairment, and oftentimes this stage goes unnoticed because symptoms are not that apparent. And the brain is just beginning to change, basically. And when we progress to stage 2, we see very mild cognitive decline. So basically, stage 1 is not diagnosed, I would say. So no one will be like, oh, this is stage 1 dementia in practice, in reality.
Yeah.
Stage 2 have like very, very mild cognitive decline, and symptoms might mimic normal aging, such as like, forgetfulness about the names and where the items are placed and stuff. And, normal aging can affect like about 40% of seniors, in different stages, in different ages. But it's not always leading to dementia. It's important to know because a lot of people are afraid that, oh, I'm forgetting stuff. Am I going to get dementia?
I know, right?
It's a big question I get from a lot of people. Yeah, but it's just only 1% might annually progress into more severe stages of dementia.
Yeah.
The stage 3, we have mild cognitive impairment. There's more evident memory loss, and this can impact the daily function mildly, I would say. And maybe like 10 to 20% of people of age 65 and older might progress to diagnosable dementia within a year if they experience this stage. And in stage 4, again, there is like a little more severe cognitive decline. We would say a moderate cognitive decline. The symptoms and the personality changes become more noticeable, leading to diagnosis of mild dementia. Usually when we start to diagnose dementia, they're in stage 4 and above. And patient experience increased difficulty with routine tasks and significant type of memory lapses. Then it can progress to stage 5, which is a moderate to severe cognitive decline, known as a mid-stage dementia, if you will. Usually in this stage, patients struggle with daily activities and they require more support. They exhibit more pronounced memory loss and confusion. And in stage 6, which is severe cognitive decline, basically, the daily caregiver support becomes essential for even the basic tasks. The patient might face sleep regulation issues, personality changes, and they may not even recognize close family or friends. And in stage 7, which is the very severe cognitive decline stage, patient can no longer care for themselves and they might lose verbal abilities and even mobility might be lost. And this stage involves a significant impairment of bodily functions and needs like basically 24/7 care. So this was just a blurb of different stages, but again, getting back to that, it's oftentimes a lot of overlaps between stages. So we don't usually focus or put a lot of weight on, hey, what stage are we in? A lot of physicians, a lot of physicians might tell you, oh, it's mild, moderate, or severe. That is like a more routinely used staging for general population purposes.
Yes, and I want to ask you, have you ever come across a case whereby somebody is diagnosed with dementia and they refuse the diagnosis? Like, I've read some articles saying,
Yeah, this is a very good point because many patients, like almost all patients, especially, I would say even in different stages, because in the initial stages, well, the patient has some cognitive function left, and they might also be in the stage of, I would say, not accepting the diagnosis, denial, if you will. I mean, and that can happen in both patient and their caregivers or their family members. They deny. There are symptoms, there are some cognitive impairment, but they chalk it up to, oh, it's normal for everyone. It's normal aging. And they refuse to believe that. And then when it gets severe, they even may start to confabulate about things that they don't remember. Like they may go on and on about like a memory that's non-existent, or they might make things up in order to, that's kind of a coping mechanism for themselves in order not to face that diagnosis. And this is basically, I would say, the hardest part of dealing with a dementia patient. The fact that they don't accept the diagnosis, they may refuse to get assessments, they may refuse to get treatments, and this can be constant. It's not going to go away. The issue is that you might face with this issue, and then you talk to them, you use different strategies, and you get assessment and stuff like that, and they might comply for some time, but then again they might be like, no, there's nothing wrong with me, and like that can become a conflict.
Okay.
And that's, I would say, one of the biggest challenges of the caregivers and the physicians to deal with this situation.
Yes. So what are the consequences of refusing the diagnosis? To talk to them, the caregivers, as well as people who might be living with dementia, what are the consequences of not accepting the diagnosis?
The biggest one is that they refuse care, both in the sense of refusal of assessment, like even coming to a doctor. When you tell your loved one, hey, we think that this thing is happening, and usually in early stages, there is still communication, there is still cognitive abilities left. So you talk to them and you say, hey, we think something's wrong, let's go get assessed and stuff like that. And they deny or they don't accept, then things will just stay there, and they refuse to get assessed, and also they might refuse to get help or care. And essentially each person want to keep their own independence and their own abilities. And it's very hard for a person to accept that, oh, I might need help even finding my own address, because that's a big emotional burden on the person. So they might refuse that, and that kind of might delay the care, that might cause into incidences like, hey, you're locking me in my own home, why? And then we might be more relaxed about that, and then they might get lost. This happens all the time. They might start measuring and they get lost. Or if they live alone, let's say it's a parent who lives alone, one day we go there and we see that the stove is left on and there's like some incident like that, or some even more severe physical damages and stuff like that.
Yes.
So there's a lot of consequences that can happen. Yeah. That's why bringing this awareness is very important for everyone, even for, if people see or feel any of these symptoms in themselves, but even more importantly for family members, for children, for spouses, for significant others, to make sure to discuss these things and get assessments sooner than later in order to prevent those consequences that we are mentioning, because it's vast. Anything can happen. Forgetting to take medication can cause health issues. Not having the ability to do the daily routines like, cooking, cleaning, bathing, things like that can have physical and social issues.
Yes.
As I mentioned, getting lost in the neighborhood, it can even get more severe and cause like more fatal and irreversible damage, or cause even death in some cases.
No, it's hard because I came across one case where this person refused the diagnosis. And so they did not plan for anything. And now this person is lost communication, lost mobility, and they have not written their will to say, this is what I need to happen. And it's putting so much strain on the family, because the family now don't know what would their loved one wanted. Would their loved one wanted to be resuscitated? They don't know, because this person refused the diagnosis. So that's why we have to.
This is a great point you mentioned, and I have talked about this in my book in length as well, because this is something that, especially working in inpatient side, we deal with it every day, basically, because
Okay.
if you wait and not care about things, or wait longer and longer and longer until things get more and more severe and the patient loses their cognitive ability
Yeah.
altogether,
Yeah.
then there's no way to know exactly what would be their wishes in terms of their health when it comes to, making a decision about that.
Yes.
And I advise everyone, even like, young, old, any age, because you never know what life will bring in. And we deal with this issue all the time in the hospital,
Yeah.
because people haven't made their wishes clear. This is a hard conversation to have.
It
And
is.
I give it to the patients. I mean, no one wants to talk about it because it's, we know that we will get there someday, right? No one lives forever. But we refuse to start thinking about that because it's such a hard thought and a hard conversation.
Yeah.
We don't want to sit with our kids and talk to them and say, hey, listen, if my heart stops and my breathing stops, do I want chest compressions? Do I want a tube down my throat for breathing? Do I want a feeding tube or not? Do I want prolonged care on the machines and stuff like that? And a lot of times what happens is the family have hard time to let go. This has been my experience. If you ask people who still can think,
Mm-hmm.
most of the time, like more than 95% of the time, they would say, listen, if my life is not meaningful, do not prolong it. If I'm not there, if I'm
Yeah.
not communicative, if I'm
Yeah.
not enjoying my life, do not keep me on the machines. I mean, preferences might be different, but overall, this is what everyone would say. Oh, I don't want to live like that. But then what happens is they don't have this conversation, and it comes to a point that the patient is not there anymore cognitively. They cannot voice their wishes. And then family members, the significant others, children, they cannot let go. They'd be like, oh, I feel bad if I say, oh, do not prolong this, or do not put a feeding tube and stuff like that, especially in dementia. And there has been studies, especially.
Uh-huh.
So let me give you this
Please do.
scenario that happens all the time.
Oh, yeah, please.
There are demented people who have okay health, like, their body is okay. I mean, it's
Yeah.
functioning and everything. One of the first things that will be diminished when we get older and older, as a sign of the body basically checking out, is losing swallowing ability. So losing the coordination and strength to swallow well,
Yeah.
which we call it dysphagia or swallowing dysfunction.
Yes.
Now, when it comes to that, the patient might start aspirating, having pneumonias and stuff, and getting admitted to the hospital. And they get assessment by a swallowing specialist, and we do tests and stuff like that. And we say, oh, this patient is not safe to eat anymore. Now imagine there's a patient who has a okay functioning body otherwise. They have severe dementia and they
Yes.
cannot eat. So what happens is a lot of families will be like, we cannot starve them. Let's put a feeding tube. Let's put a tube. And the feeding tube is a tube that they put in the stomach from outside. They make a hole and they start and feed the patient. This thought might seem reasonable and logical to a lot of family members because, they don't want to starve their loved ones.
Yeah.
But the reality is, the studies have shown that it does not improve the quality or quantity of life. So it does not improve mortality or morbidity in severely demented people.
Yeah.
And quite frankly, it might become a kind of a torture, like force feeding, because the body says, listen, I'm done.
Yeah.
I don't want to eat. And a lot of times, even the swallowing is fine, but the patient does not want to eat. I have 95-year-old person with otherwise okay functioning body, but they're like, I don't want to eat. No appetite. In these people, putting a feeding tube and feeding them could be like a, force feeding type of thing,
Yeah.
which they might not want otherwise. So it's very important what you mentioned as far as making those wishes clear and talking to families. And it's important for the families to respect those wishes. Now, it's not always the severe end of the spectrum type of situation. So a lot of times we're dealing with gray areas in between. So we hold a lot of conversations with the families. And also we have compromises. For example, when we have a swallowing dysfunction type of thing, we give modified diets. And I have talked about this in my book. I have like a bonus book as well on nourishment, the nourishing the mind. Which I can send you the link to that as well.
Yes, please do.
I talk about like modified diet and how we can, prepare easy to swallow diet and stuff like that. That's one of the compromises. But getting back to what we discussed, having these type of conversations as early as you can, even again, when you're young and healthy, having your will, like it's been, I would say 6 years that I want to write my own will. I haven't done that.
Because you think you are young.
I'm like, it's hard. It's just hard to even think about that. And like sitting and doing that, you'd be like, you know what? It's fine. Nothing's happening to me now. But how do I know?
How do we know?
Yeah. How do I know? It's like people who go out and God forbid, I don't know, get in an accident, weren't planning for that. They didn't know it's going to happen. So that's a good advice that you mentioned to give to people. Listen, do that as early as you can.
Early as possible. I don't know whether you know about Wendy Michelle. She was a champion for dementia, really, in the UK. She died, I think, in February. She knew what she wanted. She was sure. She laid out everything that needed to happen. I read somewhere that even at the end, she refused to eat. She said, no, I don't want to go through this because I know it's not going to get me back to life again. And then she died.
Yeah, and making that happen peaceful and with dignity is, I think, one of the things that families should really think about hard, because life consists of our body functioning and our mind functioning. Yeah. When mind is not functioning anymore, oftentimes we should say, well, what's the point of just dragging the body in that? And again, it all comes down to a personal preference and respecting that. But I think it's a very important point. And I did talk about this in length in my book.
Okay. So tell me now, Dr. Sam, somebody's now diagnosed. What's the next step for the person living with dementia and for their caregivers?
Right. Yeah. This transition is very important and it's oftentimes very challenging because all of a sudden you find yourself as someone who will need care more and more on a daily basis. And your significant other or your home caregiver all of a sudden will find themselves in a new role of a caregiver, which they never had before. They were like living their life with their spouse or their, parent or someone. And now all of a sudden they're like, oh, I'm a caregiver. We're like, what should I do? So a lot of stress and anxiety will come and a lot of questions and a lot of uncertainties will come.
And resentment.
Oh, yeah. Yes. And resentment and guilt and a lot of ramifications. And at the beginning, it's hard to deal with because see, like any other disease that don't have a cure, like, cancer or any other disease, it's hard to fathom that, okay, so this is a condition that is not going to end in everything going back to normal. That's not going to happen. So this is like a progressive condition and things are going to continue to get more and more challenging. I'm not going to say things are going to get worse because that's a cruel interpretation of things.
I know,
but
right?
More and more challenging. And there's way to deal with those challenges. There's always way to deal with those challenges. So at the beginning stage, thinking about this is very daunting. It's like, oh my God, what's going to happen? This is the end of it. Like, our lives is over. Everything is over. But think of it this way. The positive is that you're going to have a long time to adjust with things. Things are not going to happen overnight. It's not a disease. It's not a condition that will hit you hard in 1 week or 1 month. So you're going to have time and you're going to have to take things one day at a time. And that gives you enough time to adjust yourself as a caregiver and to adjust your loved one as a, patient with a condition that needs care even more and more throughout the time. So
Mm-hmm.
this adjusting period is very important in a couple of senses. The number one is that the acceptance and having that conversation with someone, with a support group, with your friends, or with other people who are dealing with this condition. So you can start making that support group for yourself in order to get introduced to all the different things that might be coming. Accepting that and coping with that is an important step during that way. The number two is to get more and more informed about, number one, what is this condition? Like, what happened? I introduced a three-phase, a triple A type of approach to dementia in my book. The first A is awareness. So making sure that you have that awareness is very important. So you research, you read, you talk to your doctor, you talk to people who had that condition before or have their loved ones and stuff dealing with that condition, to make yourself informed, and that awareness will give you confidence. So you're not dealing with an unknown anymore, because dealing with unknowns are always scary. But once you know, what is this? Okay, this is going to happen now. This is going to happen later. And this is what I need to do and stuff like that will give you confidence and will give you comfort and will prevent stress and anxiety.
Yes.
So once you get that awareness, the number next would be to make sure you have enough support for your loved one and yourself.
Yes.
So what does that mean? Like, if I'm a significant other who works full time, or if I'm someone who have, everyone has their own thing in the life.
Yes.
You should think of this new responsibility emerging in your life and make sure that you can provide enough care for your loved one. And if the need goes up and up during the time, you have enough help. That could be your other family members, that could be friends, that could be other support systems, that could be paid caregivers at home, that could be at some point, and we can talk about this as well, at some point that could be facilities that you can use for your loved one. That's one side of it. The other side is to make sure that you have your own support as well. Like, for example, if I'm a family member who is willing to give a lot of care to my loved one, or a full-time care to my loved one, and be their person of care and be their caregiver, do I have enough support to have my own life sorted out as well, regardless of my loved one? Which means that, how am I dealing with my emotional issues? How am I dealing with my stress, guilt? How am I taking care of myself? How am I preventing burnout in this new role, which is very important? If I'm not feeling well, if I'm stressed out, if I'm just giving care to someone and not caring about myself, then things will not work out for me or my loved one down the line. So making sure you have these two support systems is important as well. And then the next part is to keep learning and learning, because there is no one prescription, one size fits all in this. Each patient is different, and each living situation is different.
Totally different.
So the more you learn, the more you read, and there's a lot of resources out there. There's a lot
Actually,
of
that's
books.
Okay, I wanted to interject with that. I was talking to this lady. She said there is information overload. So sometimes they don't know which one to take, which one to use.
Yeah.
How do you find that this is an information that will really assist me, that is credible?
It's a very good point, especially in this day and age. There is information overload about everything. You want to know anything, you Google it, there's like 10 million results coming in, and you don't know which one to take. And this is one of the reasons that I actually wrote this book, because I figured there's like so many things out there and people get confused. Like, they go online and something links to another, and it's a video, and then it's an article, and then they just get lost. And they don't know if, number one, they're getting right information, number two, if it applies to them, and number three, if they're getting repetitive information or not, if they're getting essential things, first, and then making sure that things apply to their lives. So that was one of the big incentives that I wrote this book. In terms of general advice that I can give,
Yes.
well, number one, getting information that applies to your own situation. It could be challenging, but it's important. Like, for example, if you're dealing with a family member who is in a mild stages of dementia, don't go all the way to read about taking care of a patient who's fully dependent and need like 24/7 care and like things like that, because that might overwhelm you. So you start with finding information for early stages, for adjusting period, for how to start things up, and also make sure to find resources and information that is applicable to your own geographical area, because there are, like, for example, there's websites, there's like groups, support groups that you can approach, but if they don't apply to your own geographical area, that does not work for you.
Yes.
Apart from that, make sure if you go online and
Yeah.
search, make sure to look at credible resources, because there's a lot of blogs, there's a lot of resources that I'm not saying are saying wrong things, but their information might be outdated, might be repetitive, might not be applicable to you. So because of that, I actually did put multiple websites, like the credible ones, in my book for people to refer to. Like, for example, the Alzheimer's Association, they have a lot of good articles and a lot of good resources in their website. So make sure you're referring to a credible resource, like the big universities, the big associations, and things like that. At the end of the day, it's challenging to know.
It is, but at least for you and me, we know that we've got access to our university's libraries, where the articles that we read are peer reviewed. So it's kind of a little bit not challenging, like someone who's just going onto the internet and just search Alzheimer's.
Yeah, no, that's a very good point. And just looking for resources that convert those credible articles and new advances, into patient language. This was one of my other incentives as well, because it has been that I refer my patients to, not only for dementia, but for other conditions as well. I refer them to, there's a website called Up to Date, and it does have patient education as well, but still it's difficult for patients to understand. I tell them, hey, listen, look at this article. This is for patients. This is not a medical language, but still they have difficulty. So one of the ways to get that type of information is to talk to your physician or to your health provider.
Good.
Or to people who are actually people like you. One thing you're doing that's very noble is that you are absorbing and getting advanced information about dementia, and then change it to patient language with your podcast, with talking to them about things that they can do about all these solutions in their own language. So finding this type of resources, there's a lot of support groups that actually people, your own peers, like the caregivers who have more experience, like say there's a caregiver who's been doing this for 10 years. For sure, they have a lot of personal experience, and they have a lot of things that they absorbed and get educated from other sources, and they can, give those information to you as well. That's also a good way of getting credible information, I guess.
I want us to talk about communication. During this progression, there's going to come a time whereby somebody loses the ability to communicate in words. What are ways that we can use to communicate with somebody who have lost verbal communication?
There is basically what we call a nonverbal communication type of techniques. And I have talked about this in my book as well. But if I want to go briefly over some points that we can do, is that number one, physical contact can be very comforting. For example, if you put your arm around your loved one's shoulder, or hand holding and things like that. This is one thing that we can do throughout the day multiple times. Yeah. But at the same time, we should make sure sometimes the patients with dementia will get intimidated by sitting too close to them or standing over their head. So we should be mindful, and we should see what gives them comfort. We should avoid sudden movements around them, or harsh facial expressions, or a rough tone of voice when we talk to them, because although they may not be able to talk or to verbalize things, but they still listen, they still can listen, and they still might understand a great deal of what we tell them. So this communication might become a one-way communication at some point. So we should make sure that we have a comforting tone of voice. We don't make a lot of changes or fast-paced type of communication with them. We should use like simple commands and do not keep asking them questions, because this loss of words will not happen suddenly overnight. At first, they might lose their ability little by little to answer our questions.
Yes.
But we have a tendency to, for example, like if I ask a question of my loved one and they don't answer, I might keep asking that question. We should give them time, because it's hard for them to make up a sentence or to find the words, because oftentimes they are forgetting those words as well. Like I cannot even name a lamp. I might call it something else. So I'm struggling hard to answer your simple question. So
Yes.
you give them time. Make sure you don't upset them. Make sure the words and body language match, because at first they might lose the ability to make sentences and make words, and might lose the ability of their own way of talking.
Yeah.
But then over time, they might even lose the ability to absorb what you're telling them by words. So we should use our gestures. Like we should make sure that there is an accord, there's a harmony between our hand gestures, our facial expressions, and our body expressions in order to communicate something to them. For example, if you're talking about a positive memory, make sure you're smiling, and you're having like a like that kind of facial expression, instead of like having a poker face. They might not feel what you're talking about.
Okay. Yes.
And also they will have their own body language as well. And a caregiver over time will learn more and more what they're trying to convey with a body language, like grimacing, like making moves. That might mean I need to go right now,
Yeah.
or I'm hungry, or I'm in pain.
Yeah.
And also using visual prompts like pictures or cue cards, objects even, to communicate ideas to the patient, especially for things that they can no longer name, like, they use the word. So we can use the pictures, we can use cue cards or objects and things like that to make that connection and communication. And these have been shown to be very, very helpful.
Yeah, especially the ones for maybe for meals, like you have two options, because they cannot say you show them this or that.
Yeah, exactly. Yeah.
Yes. Okay. Let's go on to some of the behavioral and psychological symptoms. At one point, I went with the person that I cared for. We went to a restaurant, and there was one lady who was talking on the phone very loud, and the person that I cared for got agitated, and she stood up and just shouted at that person.
Yeah.
What do we do in situations like that?
Yeah, it happens oftentimes, especially the agitation and the not being able to cope with environmental stressors as good as we can do, because there's a lot of things that can happen around them. Well, of course, the number one is to prevent that to happen, making sure that there's no big stressor around them, as far as like, loud noises, unsettling situation. If the weather is bad, like if it's raining and the weather is not nice, we prevent to go out, like, for example, or we don't take them to crowded places and things like that. But it's not always easy. It's not always possible. Like, for example, if we go to a hospital or a doctor's office, anything might happen there. We might have a stressor around them and they might get agitated. So things to consider is, number one, we should make sure as caregiver, we should make sure we don't take it personal. I mean, this might seem simple to me and you, but a lot of times caregivers forget that there's nothing personal.
Not the person,
Exactly. It's like the brain changes. It's the brain not being able to cope with that. And if they shout on you or someone else, or they become agitated, or if they even hit you, it's not that they don't love you, or it's that the brain cannot handle that.
Yeah.
That's the number one. And I think this is the most important part, to make sure that we tell ourselves, listen, this is nothing personal. It's part of their disease, part of their symptoms. So now what can I do?
Yeah.
So most importantly, trying to remove them from that type of environment is the number one thing that we can do. So only talking to them and distracting them. Distraction is a very, very effective tool.
Yeah.
So if they're dealing with, like, they get into a fight with a person, or they're like, shouting to a person, immediately we can start talking to them about like something completely different. Hey, let's go to this other room. We have great food in there. Oh, there's a vending machine. Let's go check that out. Just distract them. And oftentimes this distraction technique works very well. Instead of reasoning, a lot of times reasoning does not work. To argue with them, hey, they didn't mean anything. Why are you doing this? Why are you doing that? And oftentimes it's comforting to not completely validate their aggression, but give them some credit. Like, hey, I understand you're frustrated. There's nothing wrong with understanding. I feel you're frustrated because I know they shouted. And so this is giving them some credit for their feeling will make them comfortable, and then distracting them and then removing them from that environment. I think that.
And remember, I normally carried some writing to say I am living with dementia. So I then showed that person, because she was seated behind her table. I showed that to her, and she understood. And then I had to,
That's a great.
We're running out of time. I want us to talk about your book. If I were to get hold of your book, Dr. Sam, how is it going to benefit me as a caregiver and as someone who has been diagnosed with dementia? Let's talk about it. Include your 3, what do you call them?
AAA, yeah.
AAA,
I mean, I did talk, I think, more than I was supposed to about my book. I'm so excited about this. Yeah, because it just came out about less than a month ago, and it actually, in the first week, became the bestseller on Amazon in different categories, aging category and dementia and elderly parents. So I'm very excited about that. And I get great feedback from my readers.
I saw the reviews. I'm like, people were really anyway. Talk about it. I'm got excited.
So I did work on it for, I would say, years. It's going to be like 2 years. And I did do a very deep research, and I used my own personal experiences and used a lot of different resources. And I talked to multiple different people with experiences of dementia and caregiving for dementia people. And I basically came up with this simplified AAA type of method, which, again, it's awareness, action, and assess. The awareness is the parts that I try to teach about what is dementia, what is different types of dementia as well, which a lot of people tend not to know. I mean, dementia is not just Alzheimer. Alzheimer is the most common type, but there's vascular dementia, which is very common.
Yes.
Lewy body dementia, there's frontotemporal dementia. There's like HIV-related dementia, a lot of different types of dementia that if people know which one they have and which one their loved one have, it can be very helpful in terms of treatments and everything.
Yes.
And then the action part is, okay, now how do I adjust with this as a caregiver? Like, what preparation should I make? How can I prepare my home for my loved one? How can I get support? How can I communicate with them? How can I deal with daily challenges that they have? Like, what kind of challenges I might be facing and I might be dealing with. So there's like few chapters in that area as well. And then the last part the assess part focuses more on the caregiver role themselves, which means that I focused deliberately about the caregiver's health and the caregiver's well-being and how to keep that well-being, how to tend to yourself as a caregiver to make sure you don't burn out, to make sure you don't get frustrated, to make sure you have enough help, to make sure if you're transitioning your loved one to a long-term nursing facility or something like that, how to take that, how to have that conversation with your loved one, how to have that conversation with your family members. and how to find places that are appropriate for your loved one and how to make that transition. So basically, it's an A to Z type of thing for people who are dealing with this condition, and I hope it's helpful.
Yes. I've read some articles that say that dementia caregivers face more burnout compared to caregivers of other illnesses. So I'm glad that you have something for them in that way, that it will help them. And again, just what you mentioned now, I wish we could have talked about it. This maybe the last stages of dementia, at least, where you transition to a long care facility or nursing home, as we call it here, because people feel guilty about that a lot. Yeah. So you have that in your book.
Oh, yeah. There's a big part about guilt in general, like regardless of the putting your loved one in a nursing facility, because a lot of times caregivers feel guilty all the time. They feel
I know.
they feel like they're not giving enough care. Even they feel guilty about not caring about themselves. So it's guilt in different levels. So I have a section dealing with this guilt type of situation, and especially how to know when is the time to consider moving your loved one into a nursing facility, and how to take that, and also how to deal with this feeling of guilt. Like, should there be any guilt at all? And why shouldn't we feel guilty if that time comes? Because number one, we're not going to stop our role as caregivers. We're still going to be their loved ones. We're still going to be dealing with a lot of things.
Yeah.
But it's a time that they would benefit more from a full attention from nursing facility, or even getting a professional caregiver at home while we manage things for them, while we tend to their special, medical needs, their finances, their, day-to-day stuff. We visit them, we manage basically their whole life, but they're just being cared for by professional people. And this is something that they really need at that stage. And I did talk about like how to deal with this type of guilt and how we should really not have guilt in that sense.
I can stop the podcast here because,
I love talking
that's
to you.
profound.
I want to go on for hours,
I think I'm feeling okay because I know you have that in your book. Like whoever is going to get hold of it, they will have access to it. Because for me, as someone who's doing this MSc in dementia, somebody who's speaking with different people on my podcast, people need to be assisted in that regard, because some just refuse to take their loved one, but they are not trained to be caregivers. And these people need professional assistance, So no, thank you. Any other thing that I didn't ask that we think would assist our listeners?
What I could say, this was brought up just now, the guilt parts. I can give some quick tips about how to deal with that, not as a take-home point for the whole conversation we had, but as a cherry on top. So something that we can convey to our listeners that might be helpful to them. So it's important to identify when guilt occurs. We should not judge ourselves. I mean, overall, you're a human being. You're going through a challenging experience, and it's very normal to have guilt. And what we should do is we should reevaluate our expectations. You can do something, but you can't do everything. A lot of times, the guilt comes from, oh, I'm not doing enough. I'm not doing enough. And this is a feeling everyone might have. A lot of caregivers might have that. And also, you should not stifle your feelings. As a caregiver, anger, frustration, confusion are all normal. Everyone goes through that.
Yeah.
One thing that you can do is to connect with others. Reach out to somebody, a friend, a family member, someone who doesn't even do caregiving, but someone who can listen to you. Or, a support group, a therapist, someone who you can talk to about the challenging moments that you have with your loved one without hiding how you feel. Because listen, it's okay. It's normal to be angry at your loved one.
Yeah.
It's completely fine because you're a human being. It's completely expected. And if we don't talk about it, if we just, hide everything inside ourselves, this is not good for us and for loved ones as well. In some sense, it might revoke towards ourselves. Make sure you make time for yourself. You still have your own life. Live it as best as you can and do that guilt-free. As I mentioned, make sure you go to group therapies, online group therapies, in person. You can look it up. There's tons of information out there on the internet.
Yeah.
Be kind to yourself and accept that you're a human being. Focus on quality time and find joy in small moments of yourself and your time with your loved one. Listen, if I want to tell you like one take-home point is that do not think when your loved one is diagnosed with dementia, everything is done, like everything is ended. Life still goes on. There's still a lot of great moments. Make sure to live it as best as you can. Make sure to take the most out of your time and embrace that and enjoy that. In a sense, it's good to know that, we have limited time. We all have limited time. We don't just realize that. We just don't know. So we waste our time.
Yeah.
But in a sense, we can figure that, okay, now let's enjoy even like a moment of talking, even a moment of, I have a part that the characters of my books are walking through the park and they sit on a swing and they start swinging like they were doing that when they were children. They're like sisters.
Yeah.
And that I really like that part in that moment. And they start like laughing and talking about their childhood memories. Even that moment could be like very fulfilling and very enjoyable and a great thing that can happen and you can refer to in your memory and can give you joy of life. Make sure you remind yourself of all the positive things that you've done. Our mind as human beings tend to think and ruminate about negative things, but you've done a lot of great things taking care of your loved one. Don't internalize your loved one's negative behavior. There's a lot of things that they might do that is coming from the brain changes. And this version of them is not an accurate representation of how they really feel towards you. It's their disease talking, it's their disease acting up.
True.
And be confident in your decisions. Whatever choices you make, you're doing what you feel is best with the information available to you at that time. So don't beat up yourself for like thinking, oh, last month I made this decision, but now I think I was wrong. But at that time you made a right decision. So sorry, if you let me, I'll just go on and on.
I can see that and we're enjoying that.
Yeah, I'm really interested,
Yes, it is. That's why I really like to talk to different people to hear different perspectives. But yeah, no, time is not on our side now. I would just like to take this opportunity to thank you for gracing our podcast. And really, I'm looking forward to talk to you again because, with this awareness thing, there's a lot of topics that we can still talk about, you and I. So I guess I'll give you another time so that we sit and talk for an hour again.
I love that. Yeah. Just a quick pointer. Well, you mentioned about my book, which is called The Practical Dementia Caregiver Guide. It's available on Amazon. But there's a link if your listeners go to Savvy Scrolls. It's Savvy, SAVVY, Scrolls, SCROLLS.net/dementia. So savvyscrolls.net/dementia. I have this landing page and they can put their name and email and they get a copy of the other book. It's called Nourishing the Mind. It's about the nutrition in a patient with dementia. So it could be helpful to them as well.
Okay. No, I'll put that on the show notes as well.
Oh, yeah. That would be great.
All right. Okay. No, thank you very much, Dr. Sam, for your time.
Yes.
Pleasure.
Celia, thank you so much and have a great day.
Dementia Care. How deep is your love?